season in the kingdom this year was quite strong. What about flu vaccinations or the seasonal flu jab for our kids? I mean, how old must a child be to have this vaccine, and how effective is it? Especially for school kids, because Diana, you touched on something important. Children who are in nurseries or school tend to actually be more prone to getting infectious diseases. Or
actually, flu vaccines are given after the age of 6 months. It's one of the optional vaccines. We are giving first from October to September, one shot, and then another shot after 1 month, and then every year he should take, and in the autumn he should take a 1 shot booster dose every year. This can give a good prevention of the flu.
Really?
Yeah, especially those who are having bronchial asthma, and this is a very large number of population. I'm sure one of you families have bronchial asthma. I'm sure most of the Saudi families
Me personally.
Most of the Saudi family having bronchial asthma. It's either mild, not all the severe. Most of them are mild, and those population, flu shot is mandatory for them.
Absolutely.
And also other people, if they are immunocompromised, or also even if he is immunocompetent, it is very good for the kids.
That's very good. And alhamdulillah, of course, as Dr. Manaf and of course as Russia said, that we don't really see a lot of health or let's say a lot of diseases when it comes to children who are taking the right dosage of vaccination. And this is very important for parents to have a vaccination card to make sure that the child is taking the proper amount of dosage at the right time. Very briefly, sir, can you just give us an idea about what are some of the mistakes that parents do when it comes to vaccinating their child?
Well, the most
or the most common thing they do,
most common thing is forgetting their vaccination card, or they don't know the appointment exactly. And another mistake also, they are giving vaccine in a different place, and they are not stamping on the vaccination card that they give this vaccine, and they are putting the doctors in a dilemma. How we can serve? We don't know that the baby took the vaccine or not. I think this is the most common things. And also there is some concern of some of the parents. This is wrong concern. They are thinking that immunization making the immunity system exhausted. And this is actually wrong.
Very wrong.
This is stimulating the immune system.
Exactly.
And there are some families, or fathers especially, not the mother, thinking that giving herbs to the babies are saving them from disease, or giving helba or that.
Or it's a substitute. As a substitute, which is completely wrong.
They don't want, and the mother insists, and the father, no, I don't want to give. So then we are facing sometimes kids taking 1 shot, and then 6 months, 8 months, they are not taking, and then the mother come again, and she spoke with the father, and he agreed to bring him back. This is the main mistakes that we face.
So I think parents need to actually consult more with their doctors to actually understand the significance and importance of their child getting the vaccine on time and in the right dosage. And as you mentioned, Doctor, keeping a record of what the child has already taken. Now, something very important, Dr. Manaf, can the child take the vaccine if they are ill? So if the child has seasonal flu, if they're sick, if they have some kind of medical problem at the time of the vaccine, should they still take the vaccine in the same time?
Look, simple, what we call common cold without fever is not a contraindication to take a vaccine. But if the child have a fever, this is a contraindication to taking the vaccines. Some of the other vaccines, for example, oral poliovirus, if the patient have diarrhea, severe diarrhea, we prefer not to give. But others, for example, patient with epilepsy or having recurrent convulsion, have a special in whooping cough, there is some concern in giving the vaccine of whooping cough. And also if there is a delay after the age of 6 years, we are not giving whooping cough vaccine because it makes a lot of complication to the baby, to the child.
That's interesting. And so just before we go, one last question I would like to ask you. What about, I mean, since you're a consultant of pediatrics, what about giving antibiotics to children? I know it must have some kind of side effect, but how safe is it, or how often should parents give antibiotics to children?
You know, I want to correct the wrong idea about antibiotic. First, around 85% of all the illness we are facing, it will be self-limited without antibiotic. But on the other hand, antibiotic, if it is indicated, it's not a toxic material. It's not precipitated in the body, but it makes the immune system, it's like somebody, it's stop the stimulation of the immune system. So it's not good in this way. But on the other hand, if we need it, some of the parents are thinking they are highly educated, there are no antibiotic at all. It's not a toxic. When it is indicated, it should be given. But more than 85% of the upper respiratory tract infection, it's self-limited. No need for antibiotic, especially those who are having diarrhea, fever,
especially for children, I think also.
Wrongly, we are facing a wrong practice in every place in the world. Even in Saudi Arabia, of giving over a prescription of antibiotics.
So if it is actually necessary, and parents should first consult with the doctor.
Yes, if the doctor advise there is a need for antibiotic,
then
should
you
be given.
should.
But if not, then it does. Then it does weaken the immune system, as Dr. Manaf has said. Dr. Manaf Kadori, consultant pediatrician, we'd like to thank you so much for joining us today and giving us more information about the significance and importance of parents giving their vaccinations on time.
Thank you very much.
Thank you very much for being with us. Well, we hope that was of benefit to you as a parent. And remember, as Dr. Manaf said, it's very important for you to plan on your calendar, make sure that parents are working together to